And welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Alhassan. Now, food is an integral part of our daily lives, and the quality and safety of the food we eat cannot be overemphasized. The quality and safety of foods most times cannot be dissociated from the environment. Foods produced in modern farms are often exposed to chemicals such as pesticides and herbicides, which can be mostly harmful with direct consumables like tomatoes, garden eggs, cucumber, apples, etc. Now, the preservation, storage, preparation, and handling of food cannot be excluded from the food safety channels because it has the highest affinity to poisoning. More than 600 million people suffer food poisoning yearly, and every age group is duly represented in the victim charts. That means nobody is left out. Now, the scale of the problem currently requires that the government, the producers, food consumers, and every other player along the value chain come together to ensure that we have safer foods. On Healthy Living today, Sanitarian Egene Tijani Eneojo joins us to discuss food safety, exploring the relationship between environmental factors and food safety. You're welcome to the studio, sir.
Thank you so much once again, Ms. Olamide Alhassan. You are doing a very wonderful work
Thank you
in our
so
environmental system, because information is power.
Absolutely.
And when you are deformed, you cannot get the right information.
Absolutely.
And that is why we are here to promote the work of environmental health, and it will make it easy for all of us. Thank you so much once again.
And thank you for always coming through. Thank you so much. At least it's important that we all get informed about some of these things every day. Thank you.
Thank you so much.
All right, now from an environmental perspective, let's talk about what food safety is.
Thank you. First of all, when you talk of food safety, you can't talk of the safety of food without the food itself. What is even food? Food are these edible substances we consume on a daily basis in order to quench our hunger.
True.
What is food to you may not be food to another people or another individual. So food in our environment is what we consume daily, like the vegetable, talk of the beverage, talk of the dairy, the meat, the corn, the wheat, the bread. All those things we consume on daily basis are what we call food. Then when we add safety, food safety is the safety of food you are consuming, from the farming, that is production, to the kitchen, that is cooking, to serving at the dining table,
Of course.
and then final consumption. All these factors need to be put in place. Do we talk of the transportation of this food, the safety of this transportation from the farm even to the house before it gets to the table? The process of all these things is what we call the safety of food. And when all these things are not handled hygienically, it brings about contamination of food. And when food is contaminated, it gives different scenarios. It gives diseases, it gives discomfort, it gives unhealthy livings, it brings about economic situations of the family and even on government. So food safety is one of the factors that we must look at it critically in environmental health concerns or environmental health aspect, that food safety must critically be examined, because your action, if not properly managed, can affect another life.
Sure.
When food is not properly maintained from the farm to the dining table, then it can affect the society. And that's why you see number of deaths, diseases, different kind of diseases arises as a result of consumption of unwholesome food or food that are prepared under unhygienic conditions.
You know, especially because you mentioned that unhygienic conditions when it comes to the preservation. Very recently, we heard a news where NAFDAC actually apprehended a woman that happens to always melt plastics in her vegetable oil when she's frying plantain chips for sale. And we saw that scenario where NAFDAC actually apprehended the woman for using melting plastics in her vegetable oil. Our excuse is the fact that it makes the plantain chips much more durable and it makes it stronger. Now, at this point, that is supposed to be harmful to the health. Am I right?
Yes.
Because how can people be consuming plastics? Now, how do we begin to stop some of these acts that are poisonous to our health? And what are some of the factors that could, trigger some of these issues? Because I don't want to believe that it's probably economical challenges or something. Because first things first, food is important to our body. So we know that we must eat food to survive and to stay alive. So if people know that they have to eat food to stay alive, why still try to endanger people's lives while they are trying to stay alive?
Now, the action of the woman is seriously bad, because she's just focusing on her own benefit without considering the impact of what she's doing on the health of the population. Now, you melt a plastic with a plantain chips. What does that relate to you? Are you aware of these cancer-related issues we are facing in the country today? The kidney failures, the cancer, the different kinds of these miscarriages as a result of the presence of lead in food. So a lot has happened in the society, and what we need to do is to rise up to the challenges, most especially those that are in charge of the regulatory aspects. Who is monitoring this woman? How long has it been doing? How many lives has been affected? So those things need to be cautioned. And how does she come up with these ideas? How many of them are involved in this attitude? So
and how widely has she spread this
how widely has it been spread?
Food?
And how many people have died of this without knowing what they have consumed? So food is one of the critical things, because when you go into details research about food, you are by what you eat.
Mm-hmm.
So if you are eating healthy, you live healthy. But when you are eating less of what is nutritional content, then you will be affected medically. And that's why you see, if you go to hospital today, you see different kinds of disease that you don't even know.
Mm-hmm.
There are diseases that doctors are finding it difficult to know the name, because they are strange diseases. So a lot of people, their actions have sent many people to early grave. That is not the only woman that is doing it. For her to do it, she has sent the idea to have other people, and they are practicing it.
She probably even picked it from somebody.
You understand? So our action in terms of serving food, preparation of food, transportation of food from the point of cooking to the final consumption site must be wholesome and must be hygienically certified. Otherwise, you can stop the person or the company their license. You can withdraw their license or operational permit, and they have no right or anything whatsoever to continue to practice on that act. When an individual is made an scapegoat, others will learn from it. Mm-hmm. And how will you get to know these people? You have to go on inspection from the farm to the house, that is kitchen, mm-hmm. then to the table after cooking, then to the final consumption site.
But now that's like a process,
yes,
that has to be, monitored. Mm-hmm. But now, whose responsibility is that? Is that supposed to be part of your job to do, to monitor that value chain process?
Yes, it is the duty of an environmental health officer to look into what the public consumes.
Okay.
Because food is one of the components of environmental health officer among the 24 components that we have. And when food is not prepared under monitored, under supervision of a practitioner or a well-trained personnel, it will automatically affect the society. That is why you eat food today, in the next 5 hours, you start feeling unwell. You start feeling stomach pain or stomach cramping as a result of what you have consumed. Because either it is there are presence of bacteria in that food, or the food is not prepared under hygienic condition. Either it was not properly cooked, or it was served under a low temperature, and automatically affect your system. And when you are unwell, it will affect your production, it will affect your activities,
absolutely,
it will affect
everything.
your engagement for that day, because a healthy man is the one that go out to look for what to do. Somebody that is not healthy will stay at home to manage his or her health. And that's why you see that environmental health officers are going out. Despite their limited number, they go out to inspect food to food premises, and then to satisfy that this person is physically, mentally, health-wise satisfied to handle food for public. As long as you are handling food that is meant for the public consumption, your life or your health is not your health, it's my health. Is your health.
You know, as you made that statement, I'm sure viewers at home are already saying, in my area, nobody is checking one person. No. I'm saying that, I'm sure I'm speaking for the people. Because the reason why I made that statement is that I've seen lots of food vendors that there are people that you probably won't even be able to stop by to taste their food. But yet they are serving the public and nobody checkmates them. In fact, their environment is something else. Their storage cans, you'll be amazed at the kind of food that they give the public. But it's always as though we never see anybody going to check them. If you didn't tell me today that it's part of your responsibilities, I probably wouldn't even know. And I'm sure somebody at home too is learning something. So do you think that you guys are not doing enough?
Yes, I will say that we are not doing enough. Not because we don't know what to do, but because there is a limited number of personnel going out to do this job. Like in FCT, for example, all the area councils have given out the franchise to an individual or a company to regulate what we call food premises. And this an individual go into his own and engage his brothers, friends, political associates, because it is politically motivated. And these people, few of them are the ones that knows the job. And the few that knows the job will go out along with those that do not know the job. What do you think will come out of it? There will be limited impact of the knowledge of the safety of food to the people in the society. So when a rightful person is engaged to do the right thing, you will see changes without you knowing. You will see that things begin to change because the actions of that person will circulate into the society and many people begin to key into the rightful things to do. So food premises is the duty, like I said, is the duty of an environmental health officer to go out and inspect food premises. Even before operation, you have to go there, certify the premises, do a sign, how many toilets you have, how many, what is your source of water supply, how is your kitchen doing, is your kitchen okay, what is the color of your kitchen, because it's expected of every kitchen to be painted white, just because when there's a stain, you quickly clean it and notice that there's a stain. But the moment you change it to green or you change it to red, whatever stain that is there, you play a deaf ear to it. And that continue to go. And as a result of that, your kitchen shows the quality of food you are serving to the public.
Wow.
So people need to be orientated. What of the staffs? Is there cloak room in the place? Cloak room is a room where the staff come to change their personal clothes into the official clothes. That is the uniform of, that is apron, headgear, safety boots of the agencies. So when these things are not there, it automatically sends the wrong signal. If you meet somebody today, is cooking food, he put on another man's hair that you don't know about, then you will come and serve food to the public without covering the head. Every food premises or every job has their laid down rules and regulations. They have their PPA, right? I cannot go out without putting on my uniform,
of course,
unless it's not an official assignment. So it is expected of every food handlers, those serving food, those cooking food, to be on their apron while serving the food. You go to a restaurant, you see somebody serving food with a long nails. What for? These are unhygienic practices, because you go to toilet, you use the same hand to clean your bum bum. Then you come out to the public and use the same hand to serve food for the public. There is 90% possibility of germs to hide under your nails, and then the nails can mistakenly get into the water, touch the food, and you serve the same food to the public. So we need to go out as a sanitarian. Do not be afraid of anybody unless you don't know your job. Go out, preach the gospel that, okay, food safety is a responsibility of everybody including you that is serving the food, because
Absolutely.
what you serve me, I might be your friend, I might be your relatives. If it affects me, emotionally you are affected.
Absolutely.
Health-wise you are affected. Financially you are affected, because you must contribute for me to get well. Right? So food safety is everybody's responsibilities. As we are discussing today, it is expected that there will be a lot of changes in our food premises, so that people will know what they are consuming. You talk of bakery, you see food, they are serving food in they are serving bread with bare hand.
You even
And when
find
you see it,
the
you see-
attendants sweating.
Yeah, you see them
while
sweating,
trying to
and the
make-
sweat is getting into the food, and people consume this thing. I was passing one certain time, I saw a driver bringing out empty a bread, a naked bread from the vehicle, and be pouring it on the ground while somebody else is there picking it into the leather. So those things are actions that are very wrong. I confronted the man, and he asked me, what is my own? I said, oh, what is my own? You want to know my own? No problem, give me your label. I get to his office and know that he then know that I have the right to obstruct him at his point of duty. So many of people are wicked these days. Seriously, people are very, very wicked, and as a result of that, their wickedness, they don't know the impact of their action into another person's. When you tell somebody, do not do this, you say, is it today that I have been doing it? See, if you are doing something that is wrong for 10 years, doesn't make it right.
Absolutely.
As long as you continue to do the wrong thing, that is wrong. And unless you leave that wrong thing to do the right thing, you will continue to be wrong. Your action today can affect the life of the whole country.
Absolutely.
Yes. How come about the Ebola in 2014? It's as a result of the action of one man, Patrick Sawyer. You see how we suffered from it. What about the recent coronavirus? You see the actions and how people have suffered from it, even though many people do not believe there is corona. So many of these things are actions that we look into while preparing food, while serving food, while establishing a food outlet. Many people do not even know that it is their duty to go to the area council where they want to operate food to get a permit. You cannot just come and set your table and begin to sell food.
But isn't that what we get most times these days? You find people just keep on tables somewhere and they're selling food in any community, and nobody tends to ask them questions.
That is very, very wrong. It is very, very wrong. For you to establish food premises, you must go through operational permit process. And the operational permit process, including the inspection of your premises, the inspection of the building or the areas you want to carry out your
But would you give operational permits for someone who probably just wants to have a little umbrella to sell food?
You can hide under the canopy of a large company.
Okay.
Due to your understanding with them. But that doesn't limit you from carrying out a medical examination test or carry out a food handlers training. There can be a collaboration. 2-3 people can join hands together to establish a food vendors. You fry akara, I sell bread and tea. The other person sell rice. Me, I fry indomie. These are combinations. People can come together to register a company and then obtain a permit from the area council which they want to start operation.
All right, because food has quite a lot of process. The value chain is long. So let's start from the process of the cultivation of the crops, and let's talk about factors that actually affects the safety of our food. Because since we're exploring parts of the environmental factors that affect it, such as temperature and all of that. And these days, we tend to have farmers who say the kind of rain that is falling now, we do not understand it. The kind of sun that is shining, we do not understand it. So are all of these as well very harmful to our health?
Now, when you talk of factors that are affecting food chains,
yes,
one of it is rainfall. When there's excessive rainfall, it affects the crop. When there's poor or lack of rainfall, it also affects the crops. When the time the rain is supposed to fall, it did not fall, it affects the crop. Like the rain is supposed to start from March, and then the rain started in April. Now you see that from March to April is 1 month already.
Of course.
And then the time of crop coming into the society is supposed to be June. You can see that it will automatically extend to July because of what? Lack of rainfall.
Sure.
And when this rain fall in excess, it brings about flood. And flood washes away the crops, which also affects the food into the society. These are what we call food security. When there is drought, that is the lack of rainfall that we are still discussing about, it brings about dying of crops on our farmland. So these are factors, environmental factors. What of the soil? You are cultivating the same type of crop on the particular land every year. How do you expect it to continue to grow? There's what we call a crop rotation, right? So when you do not change the type of crop you plant, and you do not apply manure to that same plant, how do you expect it to continue give you what you want? Automatically the land tenure system will continue to die down, and once it's died down, it automatically affects the food production into the society.
I know that some persons have actually tried to outsmart nature, as I would say. They'll talk about greenhouse farming, talk about some other aspects of farming, and some persons actually still go ahead and inject some of their crops because they want them to germinate properly. What are some of the risks that this poses to our health, and how can we begin to address them?
Now, generally in food safety, there are different kind of hazards that are associated with food. We talk of the physical hazards, which might be as a result of food from farm to kitchen. Let me give you a simple scenario, like those frying garri.
Okay.
When they fry garri, how do they spread it? Have you seen where they spread it before?
I think so.
They spread it on the road. They spread it on the floor.
Okay, yes.
And breeze can blow and pass a lot of sands, dust into that garri. Are you aware that they don't wash garri before we eat it?
Very true.
And once you buy that garri, you automatically eat it.
In fact, if you have any reason to pour water in garri before you soak it to drink, people will be like, you're washing away the major
content. But there's no any content in garri. It's just for you to eat and get satisfied. You can see that when you buy this same garri, at the end you see the settlement of sand in it. That sand contains dust. The dust have emptied into the water you use to eat garri. You see how gradually you are accumulating some substances into your own system.
Sure.
These are physical aspect of it. Do you talk of a suya man that is doing suya? Suya is done mostly in the night. Is there no dust in the night? And you come there, you see it open, you buy immediately. Oh God, give me test. You buy, you take. And dust.
Wow, guilty of that.
If you want to know the level of dust on suya stand, just carry a white paper and hold it in your hand. Stand there for like 30 minutes. When you finish, scratch on the paper. Whatever dust is on that paper is the number of the dust that has settled on the suya.
Oh my God. Oh, okay. I know you still have a lot to share with us, but let's quickly go on a break. When we return, please don't forget where we stopped. All right, viewers, I'm sure you're enjoying the conversation. Let's quickly go on a break. When we return back, the conversation.
As livestock production is a source of employment and livelihood in Nigeria, this raised concerns amongst experts as the demand for animal-sourced food is set to skyrocket, with an estimation of 400 million people in Nigeria by 2050. Poultry meat, beef, and milk consumption are projected to grow by 253%, 117%, and 577% respectively. Hence the need for collaboration and attention to Nigeria's livestock industry. Representative of the Federal Ministry of Agriculture and Food Security commended partners and charged all stakeholders to enhance health services of animals in order to contribute to the nation's economy.
It is imperative that we invest adequately in ventures related to animal health services in the country through partnership that will advance the sustainable productivity livestock sector through efficient and affordable animal health services that will guarantee food and nutrition safety and security, thereby enhancing the contribution of the sector to national economic growth. I'm therefore optimistic that this forum will strengthen the existing partnership and further encourage knowledge sharing as well as innovative research among the stakeholders in order to address the challenges facing the livestock health subsector in the country.
Other stakeholders reveal that to design a roadmap, there is a need to work in synergy to achieve sustainable livestock sector and food security for the country.
The World Population Review estimated that Nigerian population will hit about 264 million people by 2030. And 2030 is just a few years around the corner. There is a need for all of us in this room to work together in synergy to achieve a sustainable livestock sector and food security for the country here in Nigeria.
The threats of disease affecting our livestock pose a significant challenge to our agricultural sector. I therefore call upon all stakeholders, including researchers, veterinarians, farmers, to collaborate closely in implementing a robust disease prevention and control measures. By doing so, we can safeguard the health of our animals and protect the livelihoods of those that depend on the sector directly and indirectly.
According to the Nigerian Institute of Animal Science, NIAS, the Nigerian livestock industry is currently worth 30 trillion naira. However, this is a call for the federal government to provide measures to safeguard the livestock.
According to the 2021 WASH Norm report, Nigeria's access to basic water supply stood at 67%, which falls below 46% and 17% of sanitation and hygiene services in Nigeria. The impact of WASH issues have underscored the importance in achieving national developmental goals and SDG 6.1 and 6.2. At the federal government of Nigeria and UNICEF annual water, sanitation and hygiene review meeting in Abuja, the Minister of Water Resources and Sanitation, Engineer Joseph Telemun Utsev, outlined the government's efforts to address these sector gaps. These initiatives include the National Action Plan for Wash Sector Revitalization, the Clean Nigeria Use the Toilet campaign, the Partnership for Expanded Wash Program, amongst others.
Consequently, achieving the wash targets under SDG 6 in Nigeria is critical, and as it will contribute to the achievement of our developmental goals as a nation with regional and global implications in view of the country's strategic position. The annual wash sector review is therefore an avenue and an opportunity for all of us to jointly reflect on the underpinnings of this initiative to enable us all agree a new trajectory that will contribute to accelerating the achievement of SDG 6.1 and 6.2 in Nigeria.
Also speaking, the Permanent Secretary of the Ministry, Shehu Aliyu Chinkafi, represented by the Director, Water Quality Control and Sanitation, Elizabeth Ugo, noted that the key objective of annual review is to have a shared understanding of the progress made and lessons learned in 2023, and to agree on the key priorities for 2024 and beyond.
The key objective of this wash sector annual review is to have a shared understanding of the progress made and lessons learned in 2023, and to agree on the key priorities for 2024 and beyond. As we assess the progress made over the past year, we must acknowledge both the achievements and the hurdles encountered in our pursuit of providing sustainable water, sanitation and hygiene wash solutions.
In their respective addresses, the UNICEF representative Ronak Khan and UNICEF Chief Watch Jane Bevan disclosed the objective as well as the key priority of the WASH program. They urged for increased funding to achieve the targets.
As I mentioned, that 68% of the water is contaminated with organism. So therefore, we are working with the government and also other partners to make sure that children have gradually and progressively access to clean water. But also we are concerned about, there are many water points that are also not functional as well. So we are working with the local level counterparts to give them training so that they actually can maintain the water point. The other area is access to clean sanitary facilities as well. So this is part of this Clean Nigeria campaign, where we are working with various partners, including the private sector, to eliminate open defecation practice as well. So we are making some progress, but there's a lot to do.
The issue around sustainability is so important in terms of the sustainability check that was conducted last year, and as we know, found less than 50% of all wash systems in the country to be sustainable. It really means we need to look at management systems, functionality issues, and so on. The very last piece is financing, not only in terms of big picture financing, but also in terms of local financing, and particularly to help those most vulnerable to afford access to wash services.
The annual forum provided an opportunity for partners and stakeholders to collectively discuss progress in implementing federal government's and UNICEF WASH activities in 2023.
Welcome back. We're still on to Healthy Living and we're still discussing food safety with Sanitarian Tijani Egene Eneojo. Before we went on that break, you were telling us about suya consumption. Oh my God, that actually got to me because, trust me, I love to eat suya, so I could just get to the point and tell the malam, please, can I have my taste to start with? So I know we're all guilty of that. And talking about even kilishi and the likes, the methods of making them and all of that. But how do we begin to address some of these things?
Those things can be addressed. What I just said is only the physical hazards that are associated with this food.
Oh, true.
From farm. That is just the physical. You understand? What about the hair that you find in the food? There are physical. What about the bone that you swallowed? Have you swallowed bone before?
I once heard of someone who swallowed bone and got hospitalized, and to the point that they had to take out conduct a major surgery on him.
Yes.
Take out his entire intestine, and then it was a long process.
That is what unsafe acting food can cause human. Imagine the trauma the person passed through and how he or she cannot do what is expected of her to do within the time you have spent on the hospital. Do you talk about the economic impact of it? The money she has spent to buy a drug, to be hospitalized. And when he come back into the society, do you think that within that week, the person will be the same that he or she was before he went to the hospital?
Absolutely not. So
these are the physical aspect of it. Then you talk of the biological aspect. This time around, you are talking of the bacteria, the virus, the protozoas that find themselves into food as a result of the actions of man. You talk of E. coli, you talk of typhoid, you talk of Salmonella typhi. You talk of lead find themselves into food. You talk of lectures. These are some of the diseases that arises as a result of the biological hazards that are present in food. Then chemical, you talk of the chemical from the pesticide application from farm. Those things have effect on human when the duration of it to spend on the crop has not reached before harvest, and then you eat it within that period. It's gradually stored in your system and it comes back to you in due time. You talk of the cancer related.
You know, I've also heard of storage for beans, that people tend to store beans for years, but they say they put some sort of chemicals in it that they use for the storage. Are these things not also harmful to our health?
They are very, very harmful to our health. When you put chemical in beans, right, there is a duration that chemical should be in the beans before it can be free for the health of man. But when that time did not reach, you sell the beans because of hunger. Somebody outside there who consumed the beans will face the consequences of your action. So the presence of chemical in food, do you talk about canned food? Many of them are stored with chemicals. And when the duration of the chemical in the food has not expired and you consume the food, what do you think it will have on your system? You see cancer everywhere, cancer of the eyes, cancer of the body, cancer of the, every part of the body has cancer. It continues to grow. You talk of the lead that finds itself into food. It gives you a genetic mutation. It affects the genetic mutation of the family as a result of lead present in the food and is consumed by man.
What is lead?
Lead is a chemical substances that find themselves into the food. Either food or water. There is presence of lead. And this can be from a battery. The water from the battery contains lead.
Oh.
You get. So these actions, when they get into food, automatically affect man. Then what about the allergic reaction that arises as a result of what you consume? You buy food today, you take it, then automatically, before you know it, you start feeling vomiting. These are reactions in the system. That shows that the food is not good in your system.
Absolutely.
You get it. So food, premises, all these things can be seen or examined or noticed from inspection. And it's the duty of an environmental health officer to go and carry out this inspection to ascertain the quality of food before it gets to the public for consumption.
So let's talk about the safety of foods, especially coming first of all from the farmers' coffers. How do they safely deliver these foods without making them contaminated already?
One, food can be safe from the farm through your own action. There are ways to collect food, there are ways to package food, and there are ways to store food. From farm, you carry the food into the house, or you create a barn at work at the farm and store the food. Then you pick this food back to house. You have a cage or where you can store this food without the actions of rats, actions of flies, actions of other vermin or animals that may contaminate that food. Then you as an individual, examine yourself. If you have any skin problem, do not go close to food, especially when it's meant for the public consumption. When you have skin problem, when you are tested of hepatitis A, do not go close to food that is meant for public. When you have diarrhea, you have cholera, you are vomiting, you don't need to near food. If you have cough and catarrh, you do not need to near food that is meant for public. Because those things are things that can lead to outbreak of disease within the community, and once it affects one community, it can easily be transferred to the neighboring community. Before you know it, it becomes an outbreak in the whole country.
Okay, so in terms of storage now and preservation, what should we do? Because I know some persons would rather use chemicals than use some other natural ingredients that could actually preserve the food. So since we're exploring food safety, so what are some of the things to do when it comes to proper preservation and storage of these food items, especially even on the table of consumers, not just the retailers, even consumers?
Now, for you to preserve food, one, food must be stored at the right temperatures and must be served within the temperature. It is expected of food to be served at least 60 degrees centigrade.
Now, when you say food served, like the one I want to eat, is that what you mean?
Yes, the one you want to eat.
Like food I want to eat now?
Yes.
60 degrees?
Must be served hot.
Okay.
Yes. Let me use the word hot.
So that we will
understand.
So we'll start looking for how to measure the temperature.
When there are when there are viruses or there are bacteria that have settle within the container, and you fetch this food and may mistakenly come near the food, you can warm the food hot before it can be consumed. But food that are not meant to be consumed immediately can be stored within room temperature.
Okay. We will understand better that way. Yes.
So room temperature, so that food, there is a limit to what bacteria can survive within a certain temperature.
Okay.
So if food is not exposed to them, they cannot have access to it. Then coming to the table, all this food can be prepared and served under hygienic conditions. What of the person consuming it? Has he washed his hand? What about the nails? You went to the toilet, you have a long nail. I wonder how those that feast nails, both right and hand, eat food. Oh. I am very surprised.
Probably with cutleries, you know. Some persons don't use their hands.
Maybe with cutleries. You understand? So those things are actions that may lead to food. The food can be served, prepared, and then at the dining table still get contaminated. Even with your own hand. As you take it to the mouth, you contaminate yourself. And once you are done, you can easily transfer to the vulnerable ones within you. That is most especially the children and the women. Don't know why it's women and children always. Anyway,
maybe because our immune. I don't know if it has to do with our immune system or something. Children have weaker immune system.
It has to do with the immune system because they have the low immune system, and as a result of that, bring them down more. That is why you see that all over the world, about 600 million people suffer from different foodborne diseases yearly.
Yes, and everybody's involved.
And everybody involved, including you and I.
Of course.
Then how many people have died as a result of this? A lot of people. Which majorly 40% are children.
True.
Yeah.
We also hear of food poisoning that seems to always affect people. You find somebody say, oh, I ate food, I'm suffering from food poisoning, this, that. I'm wondering what that could be really.
Now, like the scenario we started with, the woman that fried plantain with plastic.
Yes.
You can take it from there.
Okay.
Now, a person or a food handler who prepared the food and has hepatitis A can bring about this food poisoning. I think in 2022, a lady booked a flight from Port Harcourt. Then, within the airport, he ate food. He bought food and ate it. Before they could get to Abuja here, she almost died from the food he consumed from the airport in Port Harcourt. So, when he gets here, we are the first people to be called upon. And they call them to go and examine what happened. The first point is, what have you eaten before you enter the flight? He mentioned the type of food he ate. So a delegation has to be sent from here to inspect that premises at the Port Harcourt and bring reports immediately. And when they find it, the food was served under unhygienic condition. The food has started sour before the woman served the lady.
Oh my God.
So we have closed down a lot of premises because of their actions towards the general public.
Okay, so what strategies can we begin to use to mitigate some of these risks that we tend to be exposed to every day?
Now, one of the strategies is why we are here.
Okay.
We are alerting the general public on the need to prepare food,
safely,
serve food, transport food under hygienic condition.
And even preserve food.
And even preserve their food. Another aspect is the aspect of undergoing inspection before operation.
Okay.
Every food premises should go into their area council of operation to obtain a permit. And before you obtain a permit, they have to come to your premises and carry out inspection of your premises. Not everybody are called to be a food handlers.
But
so if your health cannot permit you to sell food, there are other things that your health can permit you. So those who are not medically satisfied should not near food premises. And that is why it is expected of every food handlers to undergo a training at least twice in a year, every 6 months, and then obtain a medical certificate of fitness for food handlers twice in a year, every 6 months. Because you might be healthy from your house, but before you get to the office, you break down or you are ill. Right? So these are some of the things. Then you talk of the transportation of food. Every vehicle that is meant to transport food must be painted white. That is the regulation.
We have seen lots of vehicles that are not painted white. Maybe we'll begin to, now it's our responsibility. It's now that you're enlightening us. At least now we know that if we see any vehicle that is transporting food that is not white, what should we do?
We should call the attention of the area council.
Good. Please proceed.
So food must be transported in a painted white. They specified it white because when there's dirty on the vehicle, you quickly notice. Then food should not be served or food should not be transported naked. Like the issue of bread, transporting a naked bread from the bakery into probably from here to Kogi State. You are transporting bread naked. Do you know the level of viruses or bacteria that might be settled on food because as a result of you transporting it on this distance? So food should be well packaged from the factory before it gets or before it can be transported into the another state or within the community. Do you talk about this what do we call it? This animal, those slaughtering animal, cow. Yes, you see them carrying the meat on vehicle.
Bikes.
That is very, very wrong. It is very, very wrong. And now it is the duty of an environmental health officer in line and in conjunction with other stakeholders to arrest that. How do they arrest that? First, you have to educate them. They might not know. Most of them are doing it for job. They are doing it for their daily living. Educate them. It is when you give a time frame and they are refusing to adapt to the system, then you begin to enforce. Sure. So we have to go out to abattoir, educate the butchers, educate them that food must not, or animal or meat must not be transported from here without what? Packaged, and should not be transported on vehicle. That same vehicle is used to carry the people, those that are unhygienic, that have practiced unhygienic behaviors. Maybe you go to toilet and mistakenly the feces or the shit touch the back of.
We've not even talked about the flies that perch on some of this.
So you can see it. Flies that perch on food. I went to buy meat recently. I came there and see the level of flies on meat. Kai, I turned back. You see it. So people need to be orientated. That is why we are here. They need to be talked to. That is why we are here. Then the process of food, you cannot serve food without you undergo training. If you ask all this food, they have people who will go around to give them the paper, even them without knowing what they are doing.
Sure.
Some will tell you, is this thing even existing? You are selling food for over 10 years, but you do not know that this kind of thing is existing. So it is an action plan for all ESO to start going out to carry out inspection. There are people that are in charge of this area. Let them start coming.
All right. So another thing that caught my attention is the fact that there was a particular day I went to the market. I wanted to buy some fruits from a particular guy, and then he was attending to me. It really looked so fine, so clean. So I got some, and then in the process of trying to give me, some of them fell, and then he picked it to rinse it. The bucket he was rinsing it from is white, but the inner part of the bucket was greenish. And then the water that was inside had those green drops, whatever. And then he rinsed it from it. And I said, this is the water I'm using to wash these fruits. He did not even answer me.
That is
it. Now, it said, okay, he didn't answer me. He just ignored. And as I was going, he was murmuring like, now you go give us the water. So that is to give me an understanding that they do not even have better sources of water. So what do environmental officers do to ensure that even in some of these places, there are good water sources for people to consume?
Now, the role of environmental health officer, one of it is to also know the safety of water supply. We are not the one to supply the water, but we monitor it that the water you are using to cook food, to drink is safe for you, because your health is our concern, right? So we monitor the water. If you do not have water, it is expected of you to get it, right? It's not every nook and cranny of Nigeria that has access to public water.
Of course.
So you can have a well, so that you don't have any excuse to give. You can dig a well. The market can have a well. Not everybody will come and fetch water at the same time. So if they have a well within the water, within the market, it will help anybody. You do not have any excuse that because you do not have water, you are using a dirty water to raise meat or to wash fruit for me. No. And one thing we must also note is that we are very fond of buying fruit and then begin to eat. You come to where a malam that is selling a garden egg. Ah, malam, how much is your garden egg? Is there no testing? You carry on. Sure. Direct. You don't know the water that they use to wash the fruit. You don't know how long that fruit has been on the road and the level of dust that have settled on the food. But you come there direct, piang, you eat. That is very wrong. So all food.
True. Pick everything from them and taste.
All food must be what? Washed properly, especially fruit, before you consume them.
Of course.
You talk about the orange and those selling watermelon. They use the knife to slice it. As a result of that, they cut their hand. I was trying to buy orange one certain time and see a blood on the orange. I'm looking at how come about this orange blood on the orange? He saying you don't know. You look at his hand was cut. You don't know, and you see that it is from your hand that the blood gets to it. And then when you buy this orange, you allow them to slice it for you. Immediately you start taking it. You know that you are taking the raw blood of the seller. So people need to watch what they are eating, what they are taking. I told him that I cannot buy this orange because I've seen your blood on it. I don't know whether you have a hepatitis. And as a result of me consuming that orange, directly is going to me. Remember, it is the same knife that he used to cut the orange that he's using for the fruits. So there's every possibility that his blood
has spilled on others.
Yes.
Without being obvious.
And he's even using the same knife that cut him to slice the orange for you, to slice the watermelon for you to go and eat it. How sure are you that the blood has not gotten into the fruit you want to take? So that is that. Then you talk about the waste management that come around surround the food premises. People are neglecting a lot. When you come to a food premises, what brings about the actions of fly most is when there are odor. Because like flies, they have high sense of smelling. Here like this, you do not have flies here, right? But the moment there's an airway or a route for flies to come in and you sit here, squat here to defecate, you see flies coming. Because they have high sense of smelling. So when there is a lot of decay of waste, maybe the meat you buy from the market, you remove it, you drop it somewhere, the meat begin to decay, flies must come. And when there's presence of odor, it brings flies. And that is why you see flies everywhere surrounding the food premises. So people need to manage their waste within the food premises very, very hygienically and sanitarily. Then have the dustbin that has a cover. In the kitchen, there must be dustbin. At the shelf or where you serve your food, there should be a waste bin. Then there should be a central waste bin, distance from your premises, where you will be disposing all these ones. Then for the waste collectors to come and pick them up from there. So that is that on the safety regarding to the food within the market, within our house, within our premises.
All right, but are there emerging technologies? Because of course we live in a very digital age where technologies have come and they've taken over a lot of things. Are there technologies that we can be using to detect unsafe foods, especially when we want to buy them in the marketplace or when we want to consume them at home? Are there technologies like that have
yes, there are technology to check food.
Okay.
Like water, you have a water kit. Okay. You check the level of chlorine or the level of chemicals that are present in the water. Then the food, there are different ways of inspecting food, especially the raw food. You understand? Now, like meat, carcass from the market, cow meat or whichever meat. When you touch the meat, there are meats that have skin infections.
Okay.
You understand? When you see it, you see a kind of small stones within the body. That shows that the animal was suffering from a disease before they slaughter it.
Okay.
And that is why every environmental health officer must inspect animal before they slaughter it. Not even when it gets to the market.
But that doesn't even happen.
Because when you see an animal that is standing in an akimbo form in the layer range, akimbo form, where you see bending head like this, is standing, you know that this one is automatically sick. Or when you see how they are pale, they dry off, you see the skin, the bones, you see that this one either is not properly fed or is sick. So some of those things need to be examined from the layer range where animals are kept before they take them for final slaughtering. Right. So these are the procedures that we must look into for us to have a safe food practice and safe food consumption at our.
All right. So I would just like you in 60 seconds to give your final words to our viewers.
Thank you once again that we are here to enlighten you more on food. Food is what you consume on daily basis, and that food must be what properly prepared under hygienic conditions for you to be able to live a healthy life. There are different kinds of diseases that come as a result of your actions. You talk about the cholera, they talk about the dysentery, you talk about the E. coli, you talk about the cancer, you talk about the kidney failure, you talk about the disease that's called E. coli, Escherichia coli, and legions, or the lead that find themselves into food. So food premises must be clean at all times, hygienically maintained, and what? Obtain a permit to operate your food. And don't forget that environmental health officers are your friend. Whenever they come to your premises, please do not bribe them with food. Allow them to do their job, and the Lord will bless you.
Amen. Thank you very much. Really appreciate you for your time today. Thank you so much, Sanitarian Tijani Egene Eneojo.
Thank you so much for always
really
having us.
Really appreciate you.
Yeah.
All right, viewers, I'm sure you've learned a thing or two that even sanitarians and environmental health specialists are actually our friends. So we can as well always talk to them and stop bribing them with food. Please let them do their job. That's it on Healthy Living for today. I am Olamide Alhassan. I'll see you again next week.